Country is also enjoying new liberties this Easter weekend after 2 years of life after a national state of disaster. President Cyril Ramaphosa has relaxed the regulations, although with some conditions attached, and that includes the wearing of face masks indoors. People have also been warned not to relax their vigilance as we continue to live with the Covid-19 virus. Let's speak more about this now. Bring in vaccinologist Professor Shabir Mahdi, who's with us via our telephone line. Prof, grateful for your time. Great to speak to you as always. Let me begin by just gauging from you, to what extent do you reckon we know enough now than we did before in order to allow us to go back to what Easter used to look like pre-Covid-19?
Good morning. Thank you for having me. So the fundamental issue is not about how much we know. We certainly know much more now than we did even 6 months ago or 1 year ago. The fundamental issue is that COVID-19 no longer poses the same sort of threat that it did a year ago. And that is not because the virus has disappeared. And in South Africa, it's not necessarily because we've got a large number of people that have been vaccinated. Unfortunately, the reality in South Africa is that large numbers of people, 85% of the population, that have been infected at least once since the start of the pandemic. That is important at two fronts. Firstly, it tells us that the regulations in the past have actually worked in preventing people from being infected. But in addition to that, and more pertinent to this discussion, is that past infection actually does induce good protection against severe disease and death. So despite us having modest uptake of COVID-19 vaccines, there's extensive protection against severe disease and death, and consequently the virus no longer poses the same sort of threat that it did 1 year ago. So the move to lower level of restrictions, and in fact many of these restrictions didn't actually work in preventing infections, as I pointed out. That move is the correct move, and that's one of the reasons why the attempt to insert these regulations into the notifiable medical condition document is actually misplaced, and in fact many of these regulations are actually unwarranted.
Sure. Interesting you say that, because we've also long been told that we still don't know how long immunity lasts, especially if you haven't been vaccinated, but you've developed some kind of immunity from having been infected. In what ways does that complicate where we are and how we should respond to this moment?
Right, and the reality is that even with vaccination, in fact, immunity is not long-lasting, especially not in relation to protecting against mild COVID. Immunity is long-lasting when it comes to protecting against severe disease. We don't know how long it is. There is some waning of the immunity, but at the same time, based on our experience with other similar viruses, we expect that immunity from natural infection to last at least 5 to 6 years. But again, the other big issue that we can't forget, and this is unfortunately something we don't pay adequate attention to, is that the people that are most likely to end up in hospital and die of COVID still remains people above the age of 50. And the focus of what we should be doing should be centered around ensuring that group, people above the age of 50, more than 90% of them are vaccinated. And that is the single most important intervention that's required in South Africa. It's not continuing with policies and regulations that have simply been unsuccessful in preventing infection in our own context for a number of reasons. The focus needs to be centered around vaccination, and unfortunately all of the noise around the attempt to continue regulations that are obsolete and unfit for purpose for most part is actually detracting from what should be the main priority of the Department of Health, and that is to get more than 90% of people above the age of 50 vaccinated and convince them to do so.
Those who are sympathetic to government's plights will ask, what else can the state do to try to bring people forward to get the vaccines? At first it was a question of there being enough vaccines in the country. That was long ago no longer a problem. I wonder where you reckon opportunities still lie for the state to try to get those above 50, as you've mentioned, to come forward and finally get the jab.
It's a difficult issue. But again, it's something that we can't give up on. And the state needs to become much more focused. It's not about the number of vaccine doses we're administering. Getting 70% of the population vaccinated at this point of time is actually unnecessary because, like I said, more than 70% of the population have developed protection against severe disease, and vaccines don't work too well in protecting them against mild COVID, unfortunately. So government needs to step back. They need to start engaging with civil society, with religious bodies, and everyone else. They need to start engaging to get people to understand why the focus should really be centered around getting those above the age of 50 vaccinated and adequately vaccinated. They need to get at least 3 doses of vaccine for them to have good protection against severe disease and death. So I can't give you answers as to how to do it, but this is a discussion that we need to be focusing on rather than about about whether people should be allowed into stadiums if they're fully vaccinated.
Yeah. On that note, I mean, depending on who you speak to, the regulations even that we have now outside of what's being proposed aren't effective. You've already touched on that in some respects, but I'm interested specifically in the effectiveness of something like face masks in a context where when the Omicron variant was the most prevalent, it essentially ripped through the population despite the fact that we were wearing masks everywhere. What does that tell us?
Yeah, absolutely. And it tells us that those type of face masks that we use in South Africa don't work, and we need to accept that. Face masks do work. They work if you wear the right type of face mask, which is referred to the N95 type of face mask, which is extremely expensive, and if you wear it correctly. But if you wear a cloth mask, which doesn't have a proper seal around the nose and the mouth, it is not going to prevent you from spilling the virus into the environment, and it is not going to protect you from inhaling the virus. So the type of face mask that 99.9% of South Africans wear, unfortunately, and the manner in which they wear it, unfortunately, does very little in preventing infections or actually protecting from people from being infected.
I guess we're kind of convincing ourselves that we're doing something when effectively it doesn't amount to much. But, Prof, what we've also been told in the past is that if the virus continues to spread, even though people don't fall sick and die, it does give the virus an opportunity to continue mutating. We've seen what is described as subvariants emerge. But I imagine there's still this lingering concern around a completely different variant that may possibly undo all the work we've done. Is that fear-mongering, or is that something that's a possibility?
This is a possibility, but the reality is that it's going to happen immaterial of vaccination or not, because vaccines, unfortunately, have not been too successful in preventing spread of the virus. We've got the United Kingdom, where more than 85% of the population has been vaccinated, but there's still got a lot of virus that is circulating. So it is unsustainable for us to think that we can continue with interventions forever, because the virus is not going to go away. We need to learn to live with the virus. Now, the chances of the virus mutating and being able to evade that arm of the immune system that protects against severe disease is actually very, very low. And if that does transpire, extreme unlikely if it transpires, it means that we're going back to March 2020, in which case we need a completely different approach to COVID. And then we're not talking of COVID-19. Then we might as well be talking of COVID-22 or COVID-2023, because that can be a substantially different virus. So, yes, virus is going to continue circulating, but that is not because people are not wearing face masks. That's simply because we don't have the right tools to be able to prevent infections from taking place with the current virus, because this virus is not the virus, this variant that's currently circulating is not the original variant or virus that vaccines are constructed against.
That raises the question around what tools then government should put in place today for what we anticipate may take place tomorrow. I mean, they're trying to do that in the form of these regulations. You've already mentioned that some of them are misplaced. If you had that magic wand, perhaps the final say, what regulations or some kind of intervention would you be considering?
The most important that we can do again is goes around vaccination of the people above the age of 50. There can be some restrictions placed on indoor gatherings, and particularly when there's a surge of cases. But other than that, there's absolutely no reason for almost all of the other changes that have been made to the NMC out in its tribal medical conditions. There's almost little justification for any of the other changes.
Sure. All right, Professor Shabir Mahdi, always great speaking to you, sir. Thanks very much indeed for making time. Plenty to think about, especially as you, I guess, finalize your plans ahead of this Easter long weekend. I wonder whether or not you find that there's space to bring forward these kind of discussions in that kind of social setting, but hopefully you're empowered to do exactly that. Professor Shabir Mahdi is a vaccinologist with Wits University.